whenever we need someone who is a good speaker in the dietetics world. She's a Toronto-based registered dietitian and certified diabetes education specialist. She completed her undergraduate studies at Western University and then completed her dietetic internship at St. Michael's Hospital. I didn't know that. But anyway, I work in the same hospital, work in different departments. For almost 15 years, she has practiced dietetics in a variety of settings, including family health team, diabetes education center, long-term care home, retirement home, industry, media, private practices, and hospitals. She's very passionate about mentoring and educating individuals. She's also now currently an instructor for McMaster Continuing Education. As if she's not busy enough at home and at work, she also currently enrolled at OISE, which is Ontario Institution of, I think, Secondary Education, is pursuing a Master of Education in Adult Education and Community Development. And I had opportunities of working with Rowena at Care First, I think, at some point. And also, we can always count on her to be one of our excellent speakers at High Stroke Chinese chapter. And last but not least, I learned most of my dietetics or how to eat properly from her over the years, because I need a diet consult for our crazy work. And I'm very interested to learn. I never thought about having lunch break in my whole career, because as a doctor, you actually don't have lunch breaks. So you like food, that may not be a good profession. But I've been practicing intermittent fasting since I was very young because of that. So without further ado, I'm going to pass on to Rowena, who can tell us about how to become what you do.
Dr. Chow. Thank you, Dr. Chow, for a warm welcome. Hello, everybody. So I think is my presentation on? Who am I looking at? Oh, yes. My presentation's very different from Dr. Jane Chen's. It's more about, my path, my personal, but through that, you're going to see that dietitians can work in a lot of settings. The possibilities are endless. And like Dr. Chow mentioned, a lot of us get into the profession because we love food. Dietitians, my colleagues, my friends, we just can't stop talking about food. So again, Dr. Chow briefly mentioned, I did my undergrad at Western, and I'll talk a little bit where else can you do it in Ontario. I'm currently a student at U of T through OISE, pursuing a Master's of Education, partly because I love to teach individuals. And I also am 1 credit short at George Brown for a culinary certificate. So again, making sure that I just don't know the theory, but I'm very practical. And that's what patients know me for, just practical and realistic. And I think that's also something to keep in mind if you do consider the dietetic profession, because it's one thing to tell people eat quinoa, eat kale and whatnot, but it's another thing to really know how to make something taste delicious and realistic for that person's lifestyle. So while I was at St. Michael's Hospital, these are the rotations I did my placements in. So HIV, women's health, neurotrauma ICU, that's where you don't get to talk to people. And that's very different from my profession, because generally you get to talk to people. I mean, the initial consultation with a dietitian typically is an hour. And then follow-ups are 30 minutes, and usually it's booked, every 3 weeks, every 3 months, every 6 months. I don't plan to see patients indefinitely, but I would at least try to establish a relationship for at least over a year. I'd see you maybe 5 times. And then in between, if you'd like to email and whatnot, that's also acceptable as well. So cystic fibrosis, I actually did an elective in cardiology, gastroenterology, diabetes, renal. So I did work at Care First. So for those of you who don't know Care First, it's a very Asian, the mandate is to serve Asian Canadians. So over there, I was speaking Mandarin and Cantonese 90% of the time. long-term care, definitely everybody knows that it's an organization that serves Chinese Canadians. So I've been able to cover the Scarborough location, Darcy, Richmond Hill. And for those of you who don't know, there's actually a new Monkshorn location in Stouffville. I have yet to go, but they are also slated to build many, many new long-term care homes. So this is, again, encouraging for anybody who's considering the dietetic profession, because the aging population definitely needs dietitians. Currently, I actually work for Loblaw Companies Limited. So many of you might ask, what is a dietitian doing in a retail store? So I was actually the first dietitian to be in the retail dietitian position, and that's back in 2011. And my position is really anybody who walks through the door. I give you nutrition education. I give you nutrition tips. I worked with a lot of school age group kids, so JK to grade 12, university. Actually, the U of T medical students, the second year, all of them have to come in for a cooking school workshop and a grocery store tour. I actually worked with the residents in family medicine at Sunnybrook because I cover the Baby Village and Young and York Mills store. When I first started, I covered the Richmond Hill and Markham Loblaws, partly because as a pilot location, a pilot project, they wanted the Richmond Hill and Markham area covered, but they also wanted the Forest Hill and Baby Village. And because I could speak the other languages, up I went to Richmond Hill and Markham, but it was nice because I was able to pull in my previous experiences. So other than group education, I also do one-on-one. So again, in my day-to-day life, I actually collaborate with pharmacists a lot because in Loblaws, you know how there's a pharmacy. Actually, I do the consultations in the pharmacy room, but this is talking about pre-pandemic. Post-pandemic, the dietitian team at Loblaws have been able to completely switch over to virtual. So as you can understand, due to the nature of what I do, I'm not touching people and whatnot. So actually individuals really like the option that when they come to see me, turn on the screen, we have a conversation, you see me, I see you, right? And we're talking about food. So the idea of when somebody comes and sees me for a consultation, people are like, what's the hour like? That's a long time. So prior to that, I always ask individuals to do a little bit of homework. I ask that you provide a 3-day food record, 2 weekday days and 1 weekend day, just because a lot of individuals I find eat very different between Monday to Friday. And then on the weekends, very, very different. This is again, speaking more about pre-pandemic. Post-pandemic, sometimes individuals turn Monday to Sunday the same thing. But again, the more detail you can provide me in your food record, the better that 1 hour is really spent. Because in my field, to make recommendations very practical for you, I need to know you, right? In that hour, I ask questions about your lifestyle. So that means physical activity, your stress level, your sleeping pattern. What do you do? Because sometimes individuals, they work the typical 9-to-5 job, but also I've known of project managers who are always in the car, right? They're not able to work the traditional desk job, or they're working shift work, or they're overnight shifts, right? Or sometimes because of their stage in life, residency could be longer than 24-hour shifts, and then you're trying to eat whenever you can, right? So again, that's why I have to ask the questions I do, because it's pertinent to how I'm going to make recommendations. And again, for the young families that I do see, that's why I'm like, okay, do you have children? Who does the cooking? Because I've also met individuals, mostly pre-pandemic, but post-pandemic less. But pre-pandemic, I've met individuals who don't know the difference between an onion and a garlic, right? They didn't know what a spatula is. The cooking skill was very, very low. So that's also very important for me to know, because if I'm handing you a recipe and you don't know your way around the kitchen, that's a problem, right? And how often do you go out to eat? Because a lot of individuals, they're looking for the quick and easy. If it's not eating out at the restaurant, are you doing takeout? And even if you're not doing takeout, you're not eating at a restaurant, are you buying the ready to eat foods, right? Because that's all very relevant to what I need to know. So again, I'm currently an instructor at McMaster University for 2 courses, one involved with the retirement home community, and the other one is nutrition basics. And again, from time to time, I will do consulting for SAS Canola. So in the capacity that I'm a speaker for the Canadian Diabetes Association, and I do talks for them, and the Basel Center for Heart Health, I'm actually able to develop patient resources, more focused on plant-based eating and cultural competence. So again, in my field, because we here are in Canada, the curriculum at any of the universities are very Eurocentric. So there's a real focus and spotlight on cultural competence, and the fact that, you know what, if everybody in this room has heard, you know, the Mediterranean diet, oftentimes it's been portrayed as the best diet in the world, right? But now the whole thing is, you know what? We need to take into consideration of this multicultural population, and we need to frame it different, right? Because I've even had South Asian patients who eat very healthy foods like curry. They make their own. It's very rich in turmeric, very rich in antioxidants, but they're ashamed of what they eat because they're like, I don't have enough salmon. I don't have enough omega-3 in my diet. I need to completely change my diet, right? So that's more about my work with Basel. And then with the catering company, actually, I do some menu reviews for daycares. So that's a little bit about that. And then with Fair Law and Physiotherapy and North Markham Medical Center, it's more about working with family doctors and physiotherapists. So I didn't get a chance to mention my work in media, but I've been able to be on the radio, newspaper, and television. So again, specifically with Omni, for a period of time, I was doing a segment in Mandarin and then another segment in Cantonese. And so I don't know if everybody in the room realizes how much work and preparation goes into even producing a 7 to 10 minute segment, right? Like the day before, I have to prep all the recipes, I have to buy all the ingredients, I have to schlep it downtown, set it up, right? And even beforehand to really just, so the anchors are really nice in the sense that they let me pick the topic that I want to discuss, but even then, we have to set up a dialogue, the questions and sort of the answers. And then even on the day of, we do the recording and he'll pick and choose what we would discuss. When it comes to the radio or the newspaper, I've done pre-recording and live. So as you can imagine, live, you can get questions from the audience and it could be about everything and anything, right? So yeah, that's a little bit about me in the media. It's really fun, a lot of work. So with Hong Center for Geriatric Care, on a quarterly basis, I give talks. So it's, you know, on a volunteer basis, but I think it's really, really important just because, again, I mentioned about the aging population, and especially if they're living within the community. Oh, 10 minutes, perfect, thank you. And the caregivers, the mental health on the caregivers, the stress on the caregivers, sometimes it's unmanageable. And again, they always appreciate the tips. So during the pandemic, I actually was able to host 3 cooking classes virtually. And the joy and the happiness that it brought to these seniors and their caregivers, it was amazing just because these seniors, as you can imagine, everybody was cooped up in their house. They didn't really have the opportunity. They were scared to go out, right? But the fact that we were making the bibimbap, actually, my original menu was 1 class bibimbap, 1 class shakshuka, and then the other one was baking, the cheese muffin and souffle. But people wanted to learn how to make bibimbap so badly, we had to cancel the shakshuka, but there were also a fair amount of individuals who really like to bake. But I'm hoping to bring that concept back. And then I don't know if anybody has heard of the initiative of Care Food. So Care Food, and also I'm not sure if everybody is aware, but as you get older, sometimes individuals get swallowing difficulties, right? The pureed food. Think about the baby food. When you think of the presentation, it's not great. So as an older individual, your appetite potentially could go down, but I'm not sure if everybody in this room is aware, in other parts of the world, like Japan and other parts of Asia, they are able to make the most beautiful food in appropriate textures for seniors or anybody who has swallowing difficulties. So this project, Care Food, is to hopefully bring this concept to North America. So I think that's really exciting. So A little bit about how to become a dietitian. So here specifically in Ontario, there's 3 accredited universities by the Dietitians of Canada program. So you've got Western, and when I mean Western, I was main campus, but you're actually going to be doing most of your studies at Brescia University College because that's where the School of Nutrition is. And if you didn't know what Brescia University College is, it's the all-girls part of Western. So if you want to think about it, usually in my classes, back when I was a student, there were maybe 30 of us, and of the 30, there were 2 guys. So there are guys, right? But just be aware of that. Also, just in general, dietetics is very female dominated. So Ryerson is now Toronto Metropolitan University and University of Guelph. So why I stress the accredited programs, because a lot of individuals end up at U of T because there is a food and nutrition program, but it's not accredited by Dietitians of Canada. If you want to look out of province, then you want to go look on Dietitians of Canada website. Because all across the country, there are accredited programs, but if you want to stay close to home, these are the 3 you want to focus in on. So again, once you pick your university, there are 2 options. So if you do an undergrad in food and nutrition, it doesn't mean that you automatically come out as a dietitian. So the next step is you got to decide, are you going to do a master's or are you going to do a diploma, which is attached to a teaching hospital? So that's basically what I did. I did an internship through St. Michael's Hospital, but now they integrated it part of an educational institution and they changed it to say diploma. But more and more individuals are saying, you know what? With the amount of time I'm young, I'm fresh, I want to get that master's. But each and every one offered through the different institutions, they have a different focus. So think about the University of Guelph, the Masters of Applied Nutrition. It's 1 year. 1 year, you get a master's and you do your internship. So it's very intense. But the one at Brescia University College, it's more traditional. It's 2 years, so 1 year master's and 1 year internship. The one at Toronto Metropolitan University, it's really focused on nutrition communication. So if you want to do more work in media or, nutrition communication, for sure, this is the program. And the University of Toronto option of the Masters of Public Health, it's definitely, as the name suggests, work in public health. So that's why as you go through the program, you will realize what you want to specialize in. But if you get a general gist, the undergrad program allows you to be a jack of all trades. As you develop as a dietitian, you can choose to specialize in certain areas, but because nutrition is so broad, there's so many areas you can explore, and the possibilities are truly endless. So after your master's or your diploma, then you write your exam. And then once you pass, then you are a dietitian. Woohoo! So, and then, I kept my presentation nice and short, but this is kind of what Dr. Chow was saying. Right now, I'm busy because of these 2 individuals, the 18-month-old and the 3-year-old, and my mini golden doodle, who's almost 5. I can't believe it. But yes, these people keep me busy. Thank you.
So thank you, Rowena, and welcome Ming coming back to the center stage. I just want to mention, you probably start noticing the pattern. I got the privilege of inviting the speakers today, and they're all overachievers. And one thing let you in about Rowena. I know her for many years, and I think when you were almost just a student as you came out in the community. And one thing I was very impressed is she was able to speak English, obviously, Cantonese and Mandarin really fluently. And then I start asking, like, how you do all that? Apparently, she was born in Canada and she learned it all from just by yourself. You never took any classes.
No, Chinese school, Friday, Saturday mornings.
Yeah, I think after she told me about it, I put my kids into the Chinese school, and then my wife and I actually have some time off to ourselves finally. So that was a good idea. So Chinese school also does well. And one of the very important message about healthcare is like, you're not a computer scientist. You're not going to talk to a machine all day long. It's all about communication. So every single trainees that comes through us, we always encourage them to learn as much the language as possible, whether it's Cantonese, Mandarin, or other languages, and also the culture as well. These are all very important in our business. So without further ado, let's open the floor to questions. I'm the one causing the feedback, sorry. So, question. So maybe there's one question and then I'll ask mine later.
Yes. Yes. Totally. So my master's through OISE was started in September 2021. So pretty much I've been in master's for a year and a half and on a part-time basis, which means I do a course at a time. So if I'm on track, which I am right now, I should have only another year and a half. So it's done in 3 years. But again, oh, sorry. At U of T, you are allowed up to 6 years to complete part-time status. But right now so thankfully I have a very supportive husband. He allows me, but basically if it kind of gives you a time frame, I have to wake up at 4:30 in the morning. And sort of get my exercise done and then kind of do the schoolwork stuff after the kids go down for sleeping. But and then in terms of my ability to teach at McMaster's because the course is offered is because it's asynchronous. So I don't know if you all are familiar with that term asynchronous, which means the student enrolled can do it on their own time. So what I do is I have to mark the assignments and discussions on a weekly basis. I do have to offer a live discussion once a semester. So from 7 to 8 on a designated day, I'm able to do that. But in terms of, you're right, Loblaws, it is a full-time job. But again, my schedule depends on customer demand. So again, one-on-ones, you can imagine a very popular time frame is between 4 and 7. And sometimes I do have to work on Saturdays. But again, I'm very thankful for a supportive husband and occasional grandparents help. And also we do have part-time help too. So it kind of gives you an idea of how I'm able to do everything. I can't do everything myself, for sure.
It takes a village.
Yes.
Like, Ming, question for you. So what do you think is the most challenging part of your profession? And also, what do you think, like, you would tell other people, the young people, to come into your particular profession?
Well, I think so. I think the most challenging aspect, I think it depends on which work environment you work in. So let's say if you work in retail, is dealing with basically your patients. As I mentioned, there are some patients who are a little bit more demanding than others, especially when they're more pressed for time, ask for medication to be dispensed right away. But as I mentioned, it's not possible to do that, right? We're not just there to pick things off the shelf. We're making sure that it's safe for the patient. So that's why, again, you will basically be telling them that, explain to them what's happening so they'll be more patient. There are also other scenarios where there are patients who have some sort of mental conditions. So they come in and they could be yelling at you, they could be swearing at you. They're asking, "Oh, where's my medication?" Or it's like, "Oh, I need help. Like, if you don't dispense this medication, I will die." So basically, there's that kind of more serious topics that you want to be more mentally prepared about. So learning about to adjust, basically addressing these professionally without being affected yourself as an individual.
Completely agree. I always tell my trainees that we cannot control who are the people who come to see us. So we have to deal with all kinds of people in our profession. We're not dealing with machines. So same questions to Rowena. What do you think is the most important part of your job, and how will you encourage other people to come to your profession? And not to mention, it's challenging for you to have to handle so many things on your plates.
I think for my profession, you really do have to love talking to people. But if you like the practicalness and you like to relate to individuals, because a relationship with food is very personal, right? As I kind of hinted, it dives into all aspects of your life. So again, we're not therapists, but sometimes the initial sessions could be a little bit like therapy because maybe there's a bit of emotional eating and other issues, right? So you really have to love food and you really have to love people.
So question, You know, these people are very expensive. It's really hard to get a consult from them. So I try to get my patients sometimes to have a dietetic consult because obesity is a huge thing in my business as a heart doctor. And, you know, to get a dietetic consult, first of all, is very difficult. Number two is actually cost because there are certain professions who charge like an hour, $100 now, $120 per hour. I mean, when many people cannot afford, and these are not something that is publicly covered. So how do you see your profession is going? I think, you know, King mentioned about, you know, now the expanding universe of being a pharmacist, and you know, you can prescribe now is really fantastic, and giving vaccination. How about in dietetics? And you know, do you see an expanding role in healthcare, and why you're so indispensable in our world of healthcare?
I'm glad Dr. Chow brought this up because that's exactly why I joined Loblaws in the first place. So when I joined in 2011, it was a completely complimentary value added service. So meaning it's completely free. You can come see me one-on-one, no charge. There was no string attached because a lot of people, actually, there was a lot of kickback. They're like, hold on, you're a dietitian, you work for Loblaws, you say it's free. This is too good to be true. Are you trying to sell me PC Blue Menu products, PC products, right? But okay, so again, I told you that I covered Richmond Hill and Markham. Because of the demographics, they really respected my profession and they valued my time. So they showed up. If you made an appointment with me, you are coming to see me, right? But as the program expanded all across the country, not every area had the same level of respect. Free doesn't mean good across the country. So that's why in 2017, 2018, Loblaws actually changed our service to fee for service. And the reason why they added the price is because for accountability. There's an aspect of when somebody pays, they're like, okay, well, you know what? It deserves some of my attention, right? But having said that, still what Loblaws is asking us to charge at $110 an hour, it's still under market value comparative to the other GTA hourly costs that I know of for my colleagues or whatnot. But I think the encouraging thing is that if you have private insurance, the dietitian service is covered by most private insurances.
Okay, any questions from the floor? This one.
About ChatGPT. Because most of the ChatGPT answers the question. So what's the difference between ChatGPT and your profession? Why do people choose the career in the future? Maybe ChatGPT can replace it.
I think it applied to both. So how do you think like artificial intelligence and like large language models such as ChatGPT may affect your future of your career?
So actually, that's a funny question. It actually even goes back to when the registered clinician was being introduced as a profession. So in case that you don't know what a registered clinician is, essentially they are registered professionals who are there to check the medication that is dispensed and is appropriate for the patient. So when that profession came out, they're like, oh, the clinician is going to basically replace the pharmacist profession because again, they only see us as pill dispensers. But rather, it actually opened up the field for pharmacists to basically focus up on being clinical instead of being the clinical side of pharmacy. Now, going back to the part about the AI and ChatGPT, it cannot really replace the kind of human interactions that a professional is able to give. Like, technically, even right now, before introduction to AI, you can find all these side effects and drug interactions just by Googling as well. So technically, people always had a choice even before AI came in. But again, the focus is that as a patient, what sets us apart is that we're living professionals talking and establishing rapport with the patients and getting to know them. Like, you know, there's some days that the patient is off, the AI would not be able to know it. But by seeing the patient on a regular basis, you know, oh, there's something off with this patient. That's when you can potentially identify, oh, maybe his blood pressure is a bit lower today. That's why he's not as energetic today. So again, that's something that will basically AI would never replace the pharmacist profession.
And I echo Dr. King Chen's perspective about the human interaction. Like I was telling everybody, it's the love for people, the love for food, and particularly the love for food. So I colleagues and myself, we asked ChatGPT meal plans. Meal plans are very popular, but at the same time, people do get fatigued, right? Because we love food. We want to eat differently. Maybe not, well, some people do want to eat different every day, every meal, right? Sometimes individuals can eat the same way for breakfast for a week, and then they get tired, they get bored. So the whole thing is ChatGPT really can't replace that human interaction.
So once again, my message as a healthcare professional as well is, I mean, it's very important to know it's here, it's coming, it's going to be even more. I think right now we just have ChatGPT and talking, and meal plan is really something that we talk a lot about in our field, like, you know, getting food recommendation and also drug interaction is all like something that we count on. As human being, we cannot remember all the facts. When I was going through school in pharmacology or diet, I had to memorize everything, but now the point is about interpretation. The point is about communication. So for young people coming into our field, learning actually how to talk to people, how to understand people, get a history, those are actually very important now. The social skill is actually more important than ever before. Before you can be like a robot. Okay, what do you have? What do you want? And then now it's not good enough. Like, you know, you can be replaced by a machine for that piece. But how do you actually transcend and go above and beyond, become a human being, the essence of human being? That's actually what we care about at least at this point. Okay, question. So the questions about for King actually, the pharmacy thing. You know, the one of the thing that you know is one of a little bit of an elephant in the room is that now all the big chains are like taking over. Like I talked to a lot of my friends and colleagues who used to own pharmacy, and you know, survival becomes very difficult. So how do you see the future? Let's say Ontario, Canada, in terms of being a pharmacist, like, you know, owning small store, because usually, you know, people used to own their own store and run their own operations, but now everything is all like taken over by big chains. So how do you see the direction of going?
To be honest, it's a rough time to start your own pharmacy. I know a lot of people want it because, again, everything you earn basically goes to you instead of you earning hourly wage. But it's getting harder. I would say back a couple of years, basically in order for a pharmacy to break even, we're looking at precision counts. So basically back a couple of years ago, let's say if you do 40 scripts per day, you'll probably break even. But with everything going up, so inflation, you're basically looking at least 80 per day, basically to break even.
80 scripts to break even, yep.
Yeah, so wow. It's pretty hard. Especially these volumes that you get doesn't happen overnight. It takes a couple of years. So I would say at least a year if you're lucky. But I also had a friend who opened her own pharmacy. It took her 5 years to break even and start making money now. So again, it's a tough environment. Yeah.
But on the other hand, I think the other aspect of it is there's an expanding field of, like in the pharmacy world, that when you graduate, there are lots of things you can do, not only opening up your own business.
Right.
Like going into the pharmaceutical industry is another idea.
Yeah, exactly. Pharmaceutical industry, unfortunately, is one of the areas that I have not touched upon. There are from friends who are working in there. And then basically, I would say that one of the distinctions in pharmaceutical industry is that you get to climb up the ladder. So basically, if you're working in an environment, essentially you could be a staff pharmacist, then you move up to a manager, or it could be a store owner. That's basically as far as you probably could kind of climb. But industry-wise, you move up, basically you could be a junior, then senior, eventually manager, or even higher, essentially, but potentially head office as well. So again, there's more room to apply from that area as well. But as you, Dr. Chow also mentioned, with the new prescribing power, technically, this also is going to be added extra revenue if you do open your own pharmacy as well. But again, there's just not enough time to show whether that does have an impact on the operations yet. So it's hard to comment on that.
Now, I find it fascinating. A pharmacist is busy as it is, filling all scripts, and you now have to make diagnosis and prescribe. So I don't know how one pharmacist can do all that in one shop all the time. It's incredible. That's where AI comes in to take some of that sort of repetitiveness away. So just getting back to one point that Rowena was making, there's a book called 5 a.m. Club that my son brought to me. So with that, you should read this. It's 5 a.m. Club. I said, that's too late. I usually start at 4. Yeah, you're too late, you're 4:30. No, just kidding.
Oh, Michael.
Yeah, no, that's with trying to challenge of being a healthcare professional, balancing all the things we want to do. Sometimes you tend to wake up quite early, especially when you have young kids, because then there's like the 3 hours that you're like, really quiet, and then you can concentrate and plow through all your academic and administrative work and, your research and communication and so on and so forth. So, but anyway, now I don't do that anymore. My kids are going to bed much later, so I cannot wake up that early because otherwise I need 6 hours of sleep. Okay, as a cardiologist, the rule is minimum of 6 hours. Otherwise, your blood pressure, your heart, your blood pressure, your cholesterol, and your glucose will go up. So it defeats the purpose if you do it like chronically sleep deprivation. So you can wake up at 4 o'clock, but you have to go to bed at 10, and so on and so forth. The kids tend to go to bed fairly early. Okay, good. Pharmacy. Any other questions for our pharmacist and registered dietitian? Raphael?
Yes, let's give us your many of us for parents or grandparents, traditional thinking or beliefs about the pharmacy would be very difficult in my mind is not good at so interested in communication centuries what's your experience with that? How does that
Can I just quickly summarize the question that Raphael, just in case other people cannot hear? So question number 1 is with traditional belief, diet, something is good, something is bad, and how do you actually deal with it? And then the other questions for the pharmacist is, the challenge of dealing with traditional Chinese medicine and also 中成藥, which is like, the Chinese medicine that they brought in and believe that is good. In my world, it's like, 速效救心丹 或者係啦嗰啲咁 so that they actually like we as clinicians we actually don't know what they do, but anyway the people are taking them. So how do you deal with it?
Well, I think there's also one question about, I guess, because this belief that patients don't like taking as many medications. So actually, going back, starting a couple of years ago, there's actually a trend called de-prescribing. So basically what that means is that instead of prescribing more medication, we're trying to get rid of medication that the patients are on. So basically it's going through a medication review to find out if this medication is actually necessary for the patient. If not, then we stop it. Because again, the more medication you're on, the more side effects you're going to have, which is not what the aim of taking medications for, is to make sure that you have control of your condition without creating more trouble for you. Now, in terms of the traditional medications, this is a realm that I am not as familiar with, but keep in mind though, there are drug interactions between traditional medication as well as Western medications. So if you do plan on starting anything traditional and taking Western at the same time, it's very important to check with your pharmacist to double check that it is still a safe combination for you.
And to build off of what King just said, that's often what I would say too. If I do see that individuals are on traditional Chinese medicine, but they are also on an extensive list of Western medication, I would say, okay, chat with the pharmacist just to make sure. But in my field also, I have to be open-minded, right? Because sometimes individuals take these traditional Chinese medicines or supplements of all sort, and they offer a placebo effect, right? So, I mean, if it makes you feel good, then, and it's not harmful, I'm like, okay, right? But in terms of incorporating traditional beliefs, I think that's also part of that whole education for the society, cultural competence. There are valid points from each cultural background. So not just Chinese, but, indigenous or other backgrounds too, that have been downplayed for a long time.
So once again, I think there's a Meds check program to encourage our patients to go and talk to the pharmacist. I think if I remember correctly, it's 65 or above, or someone who takes 3 or more medication, then they are available once a year to check all your medication and combination. Is that correct, King?
Yes, that is correct. And technically, like even if you just have questions, you can just come and review it, talk to us as well. Yeah.
So thank you. I think time's up, and time to more minutes, so I'm just gonna have to present this and actually take a picture, otherwise it didn't exist.
Thank you. Thank you for your time.
Oh, yeah, no, yeah, listen in, okay. Oh, Dr. Fong.